Hey you! If you're enjoying the Singing Teachers Talk podcast, then don't forget to hit the subscribe button. We are committed to bringing you engaging conversations and valuable insights from experts across the field of voice. By subscribing, it means we can continue to do that. You'll never miss an episode, and you'll be helping to spread the word to other singing teachers, vocal coaches, and overall voice nerds. So subscribe to this channel now and just watch your teaching grow. Dr. Reena Gupta, if you had to go on any game show or TV show for that matter, what would it be?
Oh, you're starting out with tougher questions. I like the real fact-based easy ones. I would say I love trivia and I love words and communication. So it would probably be Jeopardy, but I wouldn't do well, but I would want to do it.
Yeah, I hear you. I spent a little bit of time in Chicago for about 2 months. My husband was on secondment and we got really into a show called Cutthroat Kitchen. Have you seen it?
I don't know that one.
Oh, it's amazing. It's where all these people are in a kitchen and they're making dishes, just food. But at some point, the host comes along and says, you can sabotage this person who's making a cake by taking away the cake tin.
Oh my goodness.
And it just makes them have to battle it out for, I don't know what the prize is, but it's really cutthroat and we loved it. And we don't have it in the UK, so we really miss it.
I'm gonna have to look that one up. It's like Master Chef meets Hunger Games. That's very intense.
Yeah.
I like that.
It's really great. So I think if that was in the UK, I think I'd want to go on that one.
You jump on that. I could definitely understand that. That sounds really interesting. They definitely come up with cool concepts, I feel like, over here with these shows. I should dive in more. I don't watch them enough.
Well, let's imagine that we're in a game show right now and the contestants are dysphonias or vocal injuries that appear in the clinic. And they're battling it out for the most common one that shows up. So as you are a laryngologist and you are in clinic, you are the judge. And I'd love to know what your current statistics are for the most common vocal injuries that you're seeing right now in clinic on like a top 10 countdown, if you will.
All right. That's a great question. I would say the commonest findings are kind of mild inflammation. This is not a very cute answer, I will admit it, but it's just inflammation that leads to secondary muscle tension. So we'll see allergic inflammation or smoking or vaping, and all these things make the voice go a little sideways. And then the singer is fighting against it and you get a lot of muscle tension. So now they're having pain and loss of range. I would say that's a good like 80%. It's surprising because they always come in convinced they have nodules because that's what they Googled. And it's very rarely that. So on that list, I'm going to put nodules way low, but we're going to start with just laryngitis and muscular tension. The second commonest are just small polyps, really broad-based, tiny on an edge, easy peasy polypoid things. Top 10. You know what I will say? Post-COVID, there's been a lot more viral issues with the larynx. So vocal cord partial paralyses and weaknesses of the cords. So that's really up there and it didn't used to be as common. And we actually did see in the literature that COVID caused a disproportionate amount of that. And then we'll probably go down to like the standard fare, the polyps, the cysts, and then the nodules. That'd be my list.
Okay, so actually maybe that'd be quite surprising to listeners to hear that nodules is actually not as commonly being seen right now.
Yeah, it is. I think it's because voice medicine has progressed a lot, but voice lore has not. And so what we see is that as we've become more advanced in our technology and in our ability to discern the difference between nodules and polyp and mucus, and really the technology has improved from a resolution with stroboscopy, we really get more detail. But things that used to really just appear like nodules, which is essentially almost everything, appeared like two bumps with the older technology or to the untrained eye. Now we're starting to categorize them more in a more sophisticated fashion. So we're starting to see, okay, this is actually a polyp and mucus is collecting on the other side. This is a pseudocyst with mucus. This is With stroboscopy, where you're seeing the waveform, we're seeing the paresis a little bit more clearly. So I would say that nodules are probably as common as they've always been, but we have not yet caught up to diagnostically really differentiate as well and have that permeate the culture.
You mentioned that second is the easy peasy polyp, if you like. Are those coming up for the same reasons as the nodules? Or I know that we can't ever really pinpoint, oh, it's only this that has caused that thing to happen. But is there other reasons as to why that might be your injury compared to getting nodules, for example?
I think that's a great question. What it requires is an understanding of how injury forms. So, almost all vocal injury will start with a little vascular phenomenon, a little bruising, whether that is going to be because I think of voicing as a sport. So, when you think about that high impact, long duration of work, we get bruising on the edge of the vocal cord, usually on one side. That area, as you continue to use your voice, runs the risk of forming injury. And that's what that kind of polypoid gelatinous tissue is. And then if you continue to use your voice and that's not identified, now you start to get that same traumatic phenomenon on the other side. And now you have it on both sides, but they're soft. And then voice use continues and they become harder. And now we're in nodular land. So it's actually sort of on a scale or on a spectrum rather than these two discrete entities, which is why I think nodules are less common in my practice. Because a singer, given the level of sophistication and perfection that they need on their anatomy, they're going to come to attention on this side, on the beginning phases of that injury, when that little polypoid thing is just starting, because they're going to notice increased effort, vocal break feels funny, the top feels a little bit less accessible, or I have to push harder. But that same person, if they were not as attuned to their voice, let's say they're a professional speaker, podcaster, content creator, they might not come to attention until they're further along in that injury process where we are going to call nodules more frequently.
Mm. For teachers, I mean, how many voice teachers do you see in your clinic?
So, vocal coaches and voice teachers are probably the least common. I wonder what you're getting at with the question, though.
I'm just thinking about the teacher who has 9-hour teaching days, or maybe they're in a school or something, and they don't really have any let up. It's kind of quite consistent and persistent throughout the entire day. Is it
Right.
enough? Maybe I'm asking about recovery actually, in terms of if we do have a little bit of that bruising or swelling come the end of the day from overuse, how long does that take for it to recover, and how long should we wait till we use it again?
A great question, and there's a few in there. So, what we have to think about from the bruising perspective so that we're not as scared all the time is it doesn't happen that easily, right? There usually has to be some triggering source of inflammation. So, let's take smoking, allergies, illness. Most of my singers get hurt during periods of illness where they still have to voice, right? So, now if we take that into the teaching realm, the same thing where you're around a lot of kids, you're going to get sick, and now you have to voice through that. So, first and foremost, we have to appreciate that there has to be that sort of environment of inflammation. Now, there's also different settings of teaching. So, if you take a private vocal instructor in their studio versus a school vocal coach or teacher, the person in the school is going to have larger class sizes, significantly more demand, projected voice use over that larger room. If you're teaching younger kids, you're trying to talk over them. So that the risk of injury there is significantly higher. The one-on-one private vocal coach significantly lower for all the reasons that we just discussed, but then also they tend to be able to hear themselves better. And now because you're one-on-one, that client is going to be doing a lot of the vocal lifting in a session. So it might be 50-50 or 20% the teacher, 80% the client. So not all teachers come in the same flavor. And so the injury risk is going to be different according to the kind of demand that you're under.
When it comes to nodules, are they still considered to be paired or can they appear singularly?
We do still think of nodules as paired lesions. So you're going to get that phenomenon where one sort of causes the other. And then we're not going to typically call them nodules until we see them on both sides.
Okay. And if there's just one bump, would you say that it's a different stage?
I love that you're asking this because I think it brings to light how much crappy language, forgive the language, that we have in laryngology and more in voice medicine. But I think, again, it goes back to before laryngology was a field, it was sort of being practiced like what we say in the States, like the wild, wild west. It was just call it what you will, do with it what you will, use poor technology to understand what's or to identify what's going on. And so a lot of messiness has come as a result of that because some people I have heard talk about a single nodule. And to us in laryngology, that sounds not real. So that if we think again about those stages of injury progression, some people will call that soft first stage a pseudocyst. Some will call it a polyp. Some will call it a polypoid lesion. Some will call it fibrovascular change. What we really struggle with is now that we have a better understanding of it and we have clear definitions of terms, everybody who practices voice medicine has not really taken the onus upon themselves to practice voice medicine thoughtfully, where they're learning the terms, understanding how the field has progressed, upgrading their technology. So you have a lot of general ENTs and other practitioners sort of carrying on this messy language. So it leaves us sort of at a disadvantage from an educational perspective because questions like yours are very fair. I don't know how to answer it truthfully because I would call it polypoid because I don't think of it as a pseudocyst, but anything really goes still at this point. I hate to say it.
And when it comes to the actual scope itself, what do we consider to be the better one right now? Is it the rigid one or the one that wiggles up your nose, the flexy one?
So, the most important thing for voice medicine is the light, not the scope.
Okay.
So the light should be a strobe light. And the way to identify that you've had that is there's some sort of microphone capturing your voice because that's how the strobe light knows the frequency to pulse. Now, most laryngologists I know prefer the rigid that goes into your mouth. It's quick, it's painless, it carries a lot of light because it's bigger. And the I think the resolution is better. But I know there's a handful of laryngologists who go through the nose. They feel it lets them get closer to the vocal cords because the scope can kind of just drop down from above. And I am not here to judge anybody about which scope they use. Whatever gives you the diagnostic information you want, I'm fine with.
Okay.
As
Great.
long as that strobe light is on.
Strobe is key. The thing that you were always told was coming in the club.
Yes, exactly. And it's the same technology. It's why we look like we're moving in slow motion in the club is that flickering of light. It creates that sort of frame by frame perception. And that's what we get on the chords.
Yeah. I've asked a few professionals this next question, and I'd really love to hear your viewpoint. In the scenario where a singing teacher or vocal coach really thinks it's a good idea for one of their singers or clients to go and see an ENT to get scoped, how can we best help them to follow through? Because there is that reluctancy, there is that fear, and sometimes we're left months and months, maybe years down the line, and we haven't moved forward. So, how can we best encourage them?
So I think number one, I would love for coaches to have semi or pseudo partnerships, like really close relationships with laryngologists rather than ENTs. Because right out of the gate, if you are interfacing with me, my world is voice. So I am going to be very receptive to your phone calls. I'm going to kind of work on a timeline that you tell me. So if you say, hey, Dr. Gupta, this is urgent. I need you to see this client of mine. I will make time for it because I'm going to trust you. Right. So the close relationship between a coach and a laryngologist, I think, should be cultivated because also the information goes both ways. Then what I see, I can transfer to you and you can use that to help your client. What that also sometimes does is it helps the client to feel much safer, that this is a vetted relationship, a vetted referral. You know the language of how that previous clients have done with that particular laryngologist. Whenever patients come back all the time, they're super happy, very, very easy. She's not very scalpel happy. It's not surgery all the time. So the language to diffuse some of their biggest concerns, I think, can be really empowering. So I've never had a singer go to her and be told it's the end of their career, right? Just this really simple things, or asking them very clearly, what are your concerns? What is your hesitation? Because maybe it's financial, maybe it is fear. Fear is the easiest one, so to speak, because that's just about creating a platform of trust. The financial stuff, maybe that's what the relationship is for. Hey, I need you to do me a favor on this one, right? That's what I think, that as you really start to work together with people who care as much about voice as you and your client does, it becomes a really smooth transition. I have very few coaches who tell me, I referred you somebody and they never came in, unless there truly is just something that the person is so paralyzed by fear, they won't even see the coach anymore at that point. And then it really comes down to, you can lead the horse to water, but that's really all you can do. And I have patients that I refer to other physicians, you need a gastro, you need a this, and they don't follow through. And everybody has their own reasons. And I try to let people be treated as adults and just say, look, I can only give you the information I can give you. I'm on your side. This is why I'm concerned. It's not a threat. You must see the laryngologist or else I won't train you anymore. But with that information, I can better serve you. I can help rehabilitate you. You will have a longer career because we're going to know what's going on. And it's going to be solvable 9 times out of 10, 99 times out of 100. It's solvable. This is just getting that information as to how.
Yeah. And if the singer is just waiting, just putting it off a little bit, how would you advise that the singing teacher continues? Would you say continue with caution, don't do certain technical things, or is it a case of, look, we'll just see what we can do and see what is being receptive to the things that we're implementing?
Yeah, I tell my coaches to trust your guts so deeply. Your ears are exquisitely sophisticated to issues. And especially when it's a voice you've listened to week upon week, trust yourself. You're hearing something, it's almost always real. And I don't care if real is just inflammation, it's real and it needs to be addressed. So then that's again that time for that honest conversation to say, look, I'm happy to keep training you. This is what I would probably do. I'm happy to keep training you, but I'm not going to be able to develop you and help you grow. I have to err on the side of caution and be safe. So we're going to do gentler stuff. We're going to do stuff that is gentle onsets. We're going to troubleshoot the easy part of your voice because I can't push you right now until I know that it's not going to cause an injury. And I think enrolling them saying, I want to help you, but I need you to help me help you, maybe is a tool.
And just so we're clear, what is the difference between a laryngologist and a voice specialist ENT?
I'm about to record a reel on this for exactly this reason. Again, it's deliberately muddy. So ENT equals otolaryngologist. Those two terms are the same, and it is 5 years of training in ear, nose, and throat in this country, in the US. After that, you can acquire a spot, you can apply for a spot for an extra year of training in just laryngology. That means all you're going to do is the voice box. You're going to handle diseases and diagnoses and surgery and conditions of the larynx. So you can only use that term, laryngologist, if you've done that extra year. And that we try to protect that term because what we're trying to convey is that we are true experts in the voice, in the throat. Voice doctor is sort of a meaningless term. It's a lay term, but you can call yourself a voice doctor after just ENT training because technically you've been exposed to how to take care of the voice to some degree, right? But what we're really trying to do for vocal athletes, singers, voice actors, podcasters, and content creators, professional speakers, is say that there is a field of sports medicine for the voice. That is called laryngology. And if you are a vocal athlete, You don't want to go to a generalist. You want to go to a subspecialist.
In a recent post by Dr. Jenevora Williams, she said that if we did a cross section on a bunch of healthy children, we might find that between 20 and 40% of them have a measurable vocal problem. So, in your view, when is it essential for the child singer to get scoped, if at all? And what's the difference between the recovery for a child singer and an adult singer?
I think that children singers, I still think of like vocal athletes, right? In the US, when you have a child who's engaged in a sport, they get checked every year to ensure they are healthy to proceed with that sport because we understand children's bodies are a little bit more injury prone and you are trying to have them function at a very high athletic level. So they need to be cleared for sports. So if we believe that a child singer is an athlete of the voice, so too should they be cleared annually with a check, even if all is well. Because very commonly we'll find contributing issues, allergies, reflux, that if we improve, their risk of injury goes down. Sometimes it's simple things like, hey, how you're speaking is going to risk vocal injury. And they're not educated about vocal hygiene, that vocal rest, how to care for their voice, all of those things. So that annual check is also an opportunity to have those conversations, ensure they have a coach, do all the things that any other athlete would have. My daughter swims and she has a coach and she has to get a letter from her pediatrician every year saying, I've checked her lungs, I've checked her heart, I've checked her shoulders and her legs. She is clear to perform. Why is a singer any different? So I would argue, and that's my bias, that an annual physical is required. To the question of, what types of things that we find, children tend to get kind of nodular stuff more frequently than other injuries. And I think it has to do with just how the tissue behaves under stress. And the great thing about it is it's reversible. And that's what therapy is also about, is optimizing the health and identifying why did that happen? Why did you develop a sports injury? What factors contributed to it? And let's mitigate those so that you can continue to develop injury free.
And is that the same for the child singer who's just doing it for enjoyment as well? They're not necessarily wanting to go and perform on Broadway or the West End, but they're just kind of having fun.
My daughter's not going to the Olympics. It's okay. It's still a strain on the body. It is to my mind, it's this. What's the worst that happens is you get one doctor's visit a year during which they say, actually, everything looks great. And this thing that you're training once a year and you're doing choir at school and you're doing the show, the worst thing that can happen is I can say, you look fantastic, off you go. The best thing is, hey, we found these little things that are contributing to a risk for injury, because the child who's doing it for fun is going to take likely more and more opportunities to do that, right? It's a child who's singing along in the car, who is potentially more of a performance extrovert. And so they are at higher risk. And don't we want to identify anything before it's an issue? I feel that way, but you can at me if I'm wrong.
No, I'm sure no one will. I'm just pressing the pause button on the podcast for a very brief moment to invite you to book your free BAST call. If you've been thinking about joining the BAST community through one of our courses, but you just don't know which option is the best for you, then why not book your free Zoom chat with our very own Kimberly George, who has all the answers. Head over to basttraining.com/book-a-call/ and click that big blue button. That's basttraining.com/book-a-call/. Now, where were we? I don't know about you, but I much prefer having a cold than I do the feeling of hay fever. I just absolutely abhor the endless tickle that you get in your nose and the streaming eyes. And at least with a cold, you have the excuse of laying up on the sofa and watching crap on TV, which you absolutely cannot get away with hay fever. So do the common cold and allergies, do they present the same vocally in singers? Because we mentioned as like number one on the vocal dysphonias or challenges or injuries was kind of allergic and viral?
Yeah, I think it's a great question. And the reason I lump them together is because of your reference there. They present very similarly. And so allergic people will often say on day one of their allergies flaring, I think I'm getting sick, right? You can't differentiate because it's the same process. Your body, your allergic body has decided that grass is a virus. It requires this aggressive immune response, must be launched. And so the same phenomena are happening with postnasal drip and congestion and throat clearing and coughing. Now, obviously, a viral illness will last less long. And the reason a lot of singers struggle when they get sick, I think it's because they're used to having nothing. Then they have a big bump up of symptoms with the illness, versus an allergic person is kind of always living in this little bit of an inflammatory state with little bump ups of flare. But the findings on the larynx are very, very similar. It's just inflammation. The treatment is very similar. So I'll have you really focus on nasal hygiene, so neti pots and things like that, to really focus on the decongestion and cleaning of your nose so that things don't drip into your throat and cause laryngitis and coughing.
Yeah, I think you did a great reel on your social media and had a blog on that about keeping things in the nose before it gets to the old throat and chest. So for the singer who has a deviated septum and who might struggle with doing the nasal flushes, do you have any tips for them?
Usually, if one side is obstructed, the other side is fair game. So you
Okay.
can certainly just try to do the one side, but it isn't for everyone. It is rare, though, to have a septum so deviated that you can't even get liquid in there, i.e., a neti pot. So I would say it's always worth just checking with in that case, you can go to an ENT, let them take a look in your nose and really comment on the severity of obstruction, because truth be told, your nose switches sides it breathes from every 6 hours. It's called the nasal cycle. It's funny because people often come in complaining, I can only breathe through one side at a time. I'm like, that's normal. That's how the body works. So when your deviated septum side is the side you're trying to breathe through, your brain's going to have a struggle. So if it's that obstructed, it's potentially worth attending to just from a respiratory health standpoint.
Yeah, I think mine must happen when I go to sleep at night because it's like clockwork, and I'm like, okay, now I need those breathe right
Breathe
strips. That
rights.
it makes me look really hard. Like, could
It's
beat
your
anyone up.
boxing nose. Yeah,
Yeah,
exactly.
love it. If every singer who was sick cancelled their class or didn't turn up, I don't think I'd teach a day between the months of October and March. And for episode 87 of this podcast, I spoke with an ENT called Declan Costello about this. And I'd really love your view as well on, should we still sing when we're suffering any level of cold or allergy? And how can we tell if it's safe to do so?
You're not going to tell me what he said first? You're
I'm
not
going to
going to
keep
lead the
that a
witness?
secret.
Oh, all right. Tell me after. I would agree with you. It is not practicable to cancel every time you feel vocally off, be it allergies, illness, exhaustion, overuse. Our job is to support the vocal athlete in their functioning, right? Just like sports medicine and you're sensing the theme here. This is my platform is vocal athletes. So what I say is our strategy, just like we talked about, has to be to limit the impact of these medical conditions on the voice, whether that is more aggressive allergy management. A lot of allergic people just kind of grin and bear it. And I say, that's fine for me to do. I'm not a vocal athlete, but for you, you must attend to anything that's affecting your voice, right? So being more aggressive about managing your allergies does not have to mean a bunch of medication, but just a daily sinus rinse, maybe a nasal spray, which admittedly is medication, but it doesn't really go into your whole bloodstream, can truly help to get you to vocally function. It's also important to develop those strategies before it happens when you're on tour, before it happens when you have to perform, because you need to know, how do I navigate illness and still work with my voice? Because maybe then it's a call to my laryngologist of, what strategies can I implement day to day for illness versus now I have a show. And I almost never cancel a show for illness, But might I have to give a little bit of medication? Yeah. I would rather diminish the inflammation and have you do a steroid for a day than sing on inflammation and risk the injury, right? Risk the bruising. And then I'm a believer that a good gentle warm up, usually abbreviated, can help to massage out some of that swelling so that your voice becomes more functional. But that has to really be done with a coach who understands how to do it, because you can overdo it and then actually just be worse for doing so.
Right. And when it comes to the singing lesson, because I guess we're not going to be able to prescribe a steroid for the hour of a coaching session. But when there is some swelling detected, or they come in with a humdinger of a virus, which we're all like, go away, don't come
Yes.
anywhere near me. What do you advise is part of that lesson?
So I would say that's a good opportunity to talk vocal hygiene stuff. I know a lot of teachers integrate that throughout their training course anyway. But I think sometimes it becomes we're going to do a gentle warm up. We're going to assess, are you able to phonate better after a gentle warm up? In which case we can proceed working chest voice. We're not going to be saying, hey, let's see how high you can go today. And let's really work that typical belt. Like we're going to say, let's really live in the middle, get some, maybe some music theory, maybe some vocal hygiene, maybe some cardio to kind of just break up some of that mucus that's in your chest. I think there's so much that can be done when you're not just so focused on, I must voice for this entire lesson, because vocal coaches and teachers spend a lot of time acquiring knowledge. And I think that you do it so diligently that you assimilate the information and you almost forget that you had to learn it, meaning you don't realize that your students don't know it yet. And so just transferring that knowledge over the course of a session, I think is invaluable.
Yeah. Something that we might find ourselves talking about a lot is acid reflux, and you've mentioned it in our conversation as well. In your book, the OHNI voice book, Straight Talk with Dr. Reena Gupta, I would highly recommend. And I'm not just saying that because you're here.
I appreciate it, and it's no longer available. I had to pull it for
What?
a multitude of reasons, but I am trying to re-release it. So
Oh,
I appreciate the praise for it.
well, I still have a copy on my Kindle. So
Yes, you do. You're lucky few.
yeah, I feel very smug about that now. You've talked about acid reflux and advise sufferers to note down the things that they're consuming to kind of help them figure out a pattern. What is it that we're consuming that is the culprit? If any, what are your triggers?
I don't want to admit it because it's caffeine for me. The second cup of coffee will always tip me. So for me, it's coffee, spicy food, and alcohol.
Ah,
Those are my
okay.
triggers. But the spicy and alcohol, that's easy for me to avoid. The coffee, I just stick with
You
one
can't.
and grin and bear. I can't. I can't.
Yeah. Mine are tomatoes, oily or fatty foods, and sugary things. But thankfully, alcohol isn't, although it might be. I just might be too pissed to know it.
You'll know it the next day. That's the problem. I'm a little froggy today because I did have a drink last night. I went out with friends. So it tells the truth. The truth outs every time,
Yeah.
unfortunately.
Yeah, it sucks. But what are the typical symptoms of acid reflux so we can be on the lookout for them?
So throat clearing within about 30 minutes of consuming the thing. If it's a late night meal, like it was for me last night, the next morning you'll wake up with a little bit of that like sore throat, that little bit of, some people have a little bit of almost tightness in their chest because the acid will have kind of created a little bit of airway inflammation. But the commonest symptom is heartburn, of course, but throat clearing after you've eaten
Mm,
specifically. That's what I think singers are really able to identify.
okay. And we've mentioned some of our ones, but what are the common triggers for it?
So spicy food, fatty food, chocolate, caffeine, alcohol, nicotine, tomatoes, citrus, peppermint. And then these days, we are seeing a lot of it from carbonated beverages because
Mm,
a lot of us have kicked sodas, but we carbonated water now, right? There's a
mm.
lot more sparkling water that people drink instead of, you know, non-carbonated or flat water. And that is a really big reflux trigger. And incidentally, my dentist taught me bad for your teeth.
Yeah. Oh, you know what? Sparkling water is for the bin. It's horrible.
It is.
It's a absolutely dreadful taste. I mean, I don't really like the taste of normal water, but I don't know why. It doesn't really taste of anything.
Yeah, I think that, we there was a really nice, highly effective marketing push a few years ago around sparkling water, and it took over the world. At
Yeah.
least again, here for sure. People have replaced water completely. And it used to just be back in the day, Perrier, like a few brands, but now it's everywhere and
Yeah.
it's rough on the gut.
Oh gosh. Well, speaking of rough on the gut, imagine that I have just kind of consumed this very big tomatoey, oily pizza with honey on top or something.
Oh,
It does sound quite good, actually, doesn't
it
it?
sure does.
What is actually happening inside the body once I've swallowed that and it's gone down? What's causing the thing to happen 30 minutes later where I'm clearing my throat?
So, what we believe is and understand is that certain foods, and everybody has their own triggers, will create an opening or looseness in the sphincter that keeps stomach stuff in your stomach. So, that's sort of like a circular muscular band that's on the lowest part of your esophagus or your swallowing tube. And it opens to let stuff into your stomach and then it closes again. And certain triggers will just allow it to rest open so then stomach contents can regurgitate back up and it can either just stay low in your chest, in which case we get more heartburn, or it can really come back up depending on the severity. And that's when you're going to get more laryngeal signs, the feeling of something stuck in my throat, throat clearing, hoarseness, chest tightness with breathing. So that's going to be more what we call LPR, laryngopharyngeal reflux, versus GERD, which is gastroesophageal reflux. It stays lower. It's the same process. It just refers to how high it goes and the symptoms that we attach to it.
Right.
And then that's why, too, we ask people to try to stay upright after a meal, because if that sphincter is open and now you're laying down, you've just created a really easy pathway for stuff to regurgitate. So sometimes those lifestyle strategies, that's why people do head of bed elevated, or they just really stay upright, nothing to eat within 2 to 3 hours of bed, can be really effective because you're allowing gravity to help you where your sphincter will not.
Mm. And what is it about the food that the sphincter doesn't like or relax or loves
Mm.
it so much it
It's,
relaxes?
it's like, more, please. I will open so that you can give me more chocolate.
Yeah.
I don't. That's a great question. I don't know if we know the physiology to that degree. I'll have to look that up for
Yeah.
you.
I want to know that. And also I want to know why we can sometimes consume these things and not have a flare up. And then at other
Mm.
times it's like, hello, we feel the burn.
Yes. So the people who say tomatoes don't always do it for me, they'll usually find that they'll do it when it's combined with another trigger that they're not identifying. Right?
Ah.
So it might be salad dressing, right? Where you think of that as healthy and you're not perceiving that that is creating that additive effect for you. So it's usually that you're, without realizing it, consuming two triggers at once, or overeating just a larger meal will make everybody reflux a little bit because the stomach just can't hold that all in. A late meal, a carbonated beverage alongside of it, right? So sometimes there's subtle triggers, and it's only in partnering them with one of yours that you realize I'm having reflux sometimes and not others.
Yeah. There's also something I wanted to ask about when there is a flare up, and that is once you are experiencing acid reflux, it seems, in my experience anyway, that no matter what, everything then seems to exacerbate it, even down to, and I know this is really gross, and I'm very sorry if anybody's listening or watching this and you're eating a lovely snack right now, but even down to phlegm and snot seems to make it feel really like cleary throaty or burny. And I've also had students say that when they have flare ups, even water feels discomforting. Why is that?
My best guess for that is going to be that it's not so much that the benign triggers or benign things that you're consuming are triggering you, but just the fact of swallowing anything kind of gets digestion going a little bit. And so you will maybe reflux like this much, but you're doing it in the background of significant inflammation.
Mm.
right? So it's to say, I sprained my ankle. I have a huge melon ankle right now. So now, even if I just get out of bed, I feel my ankle. It's not that getting out of bed is triggering more swelling, but you're just starting on a really inflamed background. So even benign acts will make you feel it. They're not necessarily causing worsening, but you're perceiving it. Your body knows that system's not right.
Sure, yeah, that makes sense. That makes sense. We've had nutritionist Stephanie Moore on the podcast and our blog channel before talking about this topic. And she's also given us some nutritional do's and don'ts. She's talks about reducing stress levels at meal times because we can't be both stressed and digest. We haven't evolved from cave people to need to eat a burger whilst being chased by a lion.
Right, exactly. Gosh, evolution, you're slow.
Yeah, right. Come on. Yeah, talk about fast food. Get on
I,
board.
you've
Um,
been doing this for a while, right?
she advocates for taking a shot of apple cider vinegar with live mother in water and also aloe vera gel. And equally, Stephen King and Lydia Flock recently presented their research on manual therapy intervention as a way to help manage acid reflux at the Performing Arts Medicine Association in London, which happened just a couple of weeks ago. How else would you advise that singers reduce flare ups of acid reflux and how to manage it when it does?
We really try to be diligent in our office to identifying your individual triggers. So that food journal, I think it's cumbersome and it's annoying, but it's really effective unless you want to eliminate everything,
Mm,
which most people don't. You have to live a life too. The other lifestyle things that we've kind of talked about is smaller meals,
mm,
staying upright for some time after a meal. In times of crisis, we all have unexpected triggering events. There's actually UK based the Gaviscon dual action with the
mm,
alginate in it, I think is a really nice antacid with that algae in it that create that raft effect so that you don't regurgitate as much. Those are, I would say, probably the biggest tips is really avoidance,
mm,
with the Gaviscon being your oops, I did it kind of rescue. What else? I think the the ones that you've mentioned, I love that there's research being done around it. Manual therapy, I found has been very, very successful. I think the apple cider vinegar, some people swear by, some people say it makes it worse. So I'd love to kind of see that studied better so that we can understand how it might work and does it, conclusively work. I think that we don't have great strategies outside of that. And when I find that somebody is really stuck, like they're doing everything and they're still having these episodes, and it usually either means a medication, which is my least favorite option, or at the very least, seeing a gastro, let them look and see, hey, is there something that is predisposing you to this, like something anatomic, like a hiatal hernia or something like that? Because you might have lived your whole life with such a thing, but really, as we age, we become, unfortunately, a little bit less tolerant
mm,
of insults like reflux. And so our body starts to send off those signals. And so if we're starting to see them with some regularity, it warrants an evaluation.
mm. And you mentioned the medication there as kind of like the thing you don't really want to do. Are we talking about the PPIs or things like a metrazole?
Exactly. The PPIs
Yeah.
are my last resort. I'll always start with an H2 blocker, like a Pepcid or a famotidine first, if I can, and then only escalate to that when I have to, simply because the studies have shown at about the 5 to 10 year mark, we have an increased risk of complications because we're not absorbing minerals in the same way.
Okay. And that, I wonder what your thoughts are here, because in the UK, you can get a metrazole over the counter. You don't have to actually have it prescribed anymore.
Here as well, but they'll give you 2 weeks at a time. And so could you just continue to buy 2 weeks at a time? Yes. But the bottle will say, if you find you need this more than this amount, consult your physician. So no one's going to stop you from buying it. And it just becomes on us, right? Just like with pain, right? If you find
Mm,
yourself taking pain medication every day, it behooves you to get that evaluated. Why are you in pain?
mm. Is it the same with the Gaviscon? Because I know that it's kind of like your singer's best friend, and
Yeah.
I'm going to hold my hands up and say I've been known to take it before bed most nights because I'm just like I'm going to take it as a preventative, regardless of whether I'm feeling it. Like, what are the risks of doing that as a regular thing rather than as a oops?
So, antacids, we were taught if you're using them all the time, it's a signal that something is not being adequately managed. And so it is not preventing the acid exposure, it is calming the symptoms down. So you can still potentially have the complications associated with chronic acid exposure and just not have the symptoms. So it's the same sort of thing. If you find yourself needing it regularly,
Mm.
then we are missing an opportunity to do something preventatively or surveil you for a complication. And truthfully, it's been a minute since I've done the reading on this, but my understanding too is the minerals in the antacids taken chronically, there's also, I want to say kidney issues associated with it, but nothing is benign.
Mm.
I don't even natural things or over the counters, everything has a use case that you want to really honor because you don't want to be the person upon whom we discover chronic antacid use causes da, 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 da. But I know that there's issues associated with that.
Just to end on some kind of random questions now, in the steamer versus nebulizer debate, which side are you backing?
The least fussy side. So what I feel is this: neither target the larynx directly. They're not intended to. They weren't designed to do that. Steam tends to affect your nose, your mouth, your sinuses. That's a large particle size. It lands, and that's why we feel that moisturization up north here. Nebulizers are designed for the lungs, so their optimal delivery is further down past your cords. One can easily argue both impact your vocal cords directly to some degree, right? So I I like the least fussy possible option. So some people, that means something I can hold in my hand that's a nebulizer that I can easily throw saline in and move on with my life. Some people it is I just want to throw a towel over my head or jump in the shower for 5 minutes because neither really is a proven direct vocal impact as far as I know. The last time I checked the literature, what we're really looking for is what feels best in your body and in your voice.
Mm.
And for some people, it's neither. And that's also okay. Just because people tout it as, the second coming, it doesn't mean it must be so, right? Just, I don't know. I just really think that singers, in an effort to get control over something that feels out of reach and inaccessible or only accessible by a phone, it is, you just kind of do everything. And good preventative vocal health care should obviate the need to do all of those things, in my opinion.
Mm. And there's a little bit of confusion regarding how long a singer should wait to either speak or sing after steaming. Could you help us clear this up?
I don't think that there's any proscribed amount of time. I would say, off you go and just see how it feels, whatever feels okay. The body is pretty darn good at telling you what it wants to do and what it doesn't want to do. We've all had a workout that we struggle to get started with, and one that you just feel like as soon as you get going, you go. It's going to be different things at different days because your body is in a different state each day. I don't think that there's one right answer. Go with how you feel.
Okay, great. And what are your thoughts on things like IV drips and using bits of machinery to kind of aid swelling?
I think that there's no proven benefit to the IV over oral hydration. They should be the same. And so if you are consistently hydrating, you should be fine. Now, if you have extenuating circumstances where you are behind, then an IV will certainly get into your system and make you feel more energized compared to drinking. But either way, it's not getting to your vocal folds meaningfully within the day,
Mm.
right? So again, I try to really stay away from the fussiness. And I think it's really easy when you're desperate to go for everything. I have to believe that, again, just working with somebody who understands performance voice should negate the need for a lot of those kinds of things. But
Mm.
I'm never here to say, absolutely no, never to anybody. Um, so you asked about IVs and one other, the surface treatments. I think red light is having its moment right now. I think people are really finding that there's a effect, good research to support a decrease in inflammation.
Mm.
It's low risk, no risk, potential reward compared to, I feel even an IV has some risk associated with it. So I'm more on board with those kinds of things. But again, I wouldn't be dogmatic about it. I must do it or I can't perform.
Mm.
I think those kinds of things we get into this more dangerous crutch mindset, which is if we're needing that, then we're missing something in your overall local health care.
What has been a career highlight for you so far, would you say?
There have been so many. It's one. Can I answer with a category of events? I will
Yes.
say anytime I'm able to see a singer in the office and help them with something, even if it's a medication, if it's a surgery, whatever it is, and then they invite me to attend a performance of theirs, and I watch what they're doing with this instrument that I may have just touched for a moment, it it touches me every time. It is the most meaningful thing in the world to me because that's why I got into this. I got into this because seeing somebody perform vocally, music moves me. And so to be a part of that in any amount is is so core to what I do and why I do it. It never gets old. I don't care if it is community theater or the Hollywood Bowl or the Grammy stage. To me, knowing that voice, knowing the human and how hard they're working to make that musical magic happen, and then seeing that live performance, seeing them work that instrument, may it never get old. It hasn't yet in 15 years.
That's a lovely answer. You have a 4-day voice summit coming up next month in August in Brisbane, Australia. Can you tell us a bit more about that and where we can get tickets?
Yes. Oh, thank you for the opportunity to bring it up. We have done Mindy Pack as a vocal coach. She and I have partnered on many educational events, and this is no different, except that it is a hemisphere away. We have hosted virtual and in person events. We've had people fly from Australia, dial in at 2 o'clock in the morning from Australia. And it really felt like it was time to bring an event there. So we are doing a 4-day event, all singer focused. Overlapping that separately is a 2-day voice actor event. And it is our usual cutting edge. What is the newest information in vocal health, rehabilitation, habilitation, career growth, networking? We are so inspired by the people who are doing the work down there when they're sort of fighting all of those time zones and all the different industry specific things, Australian market versus US versus UK. So we are really excited. We actually are bringing in some UK talent as well. Chris Johnson's going to be joining us. So we're so excited because we really do feel like it is innovative and it is overdue for our Australian colleagues.
Yeah. So where can we find out more about it and also more about you and your work?
The link for the conference is at savaraproject.com. That's SVARA project.com. My website is centerforvocalhealth.com. I'm also on socials, Voice Dr. Gupta and Center for Vocal Health on Instagram. So to your point, we have newsletters where we send vocal health information every week, blogs and reels and all the stuff. Our hope is to just provide credible information to elevate the dialogue around the terminology and all the things that we now know about voice that we didn't always have the privilege of understanding. So I would love to see you all on the socials and in Australia. That would be incredible. And I thank you for the opportunity to talk about it.
Yeah. Well, Dr. Reena Gupta, it's been a real pleasure spending some time with you today. Thank you so much. And don't forget to check out Cutthroat Kitchen. It's a life changer.
I can't wait. I'm very excited. I love food, so I'm in.